Thank you, Jeannie. So I thought that I would provide a little bit of perspective from the primary care side about some of the challenges that we still face in terms of treating depression. Can everyone hear me? Is this good? All right. So in any case, I thought that it would be good to start off by talking about the primary care challenges in terms of treating depression. So as Ken mentioned earlier, we know that depression is a common problem in the community and also in primary care clinics. And as we mentioned earlier, about 10% of all patients experience depression. But we know that very few people still get treated despite all of the research that's been done, that's been led by Ken and Jeannie over the years, and only half of the people get treated. And so, an obvious question is, well, this sounds like something that doctors should be dealing with. What's going on? Why aren't we getting everybody the treatment that they need? So some of the challenges that we still face, particularly as primary care doctors, is getting the patient into the room. And so I just want to see a show of hands. Who's had problems even getting an appointment with a doctor? I'm sure everybody's probably going to raise their hand for this one. But we know that, first of all, there are problems with how we do primary care here in the United States, and hopefully that will change soon. But we know what the current situation is like, that it's just really difficult. And it's even more difficult for those patients and clients that we're working with that need these safety net clinics. As we mentioned earlier, as we were hearing from other people around the room, we know that patients who are depressed may not have the energy or motivation to actually get help. There's also the issue of stigma that was mentioned earlier too, that these patients may not feel it would be appropriate for them to go. And as we also heard earlier, people have different cultural definitions of what depression is, and they might not even recognize it. So for that reason, the primary care doctor needs additional assistance in terms of getting these patients there. We need people outreaching to patients or to clients to let them know that there is help available. And we know that they not only come to the primary care doctors, but they also come to other places, social services agencies. They come to go see their ministers. We know that other people in the community can help make this identification. Getting to identifying depression. This is another problem in terms of what happens in a primary care setting. So who's ever felt that their doctor didn't have enough time for them? Okay. We know that on average, a primary care doctor's visit is 10 minutes. And we know that unless you just have one issue that's really short, that's not a lot of time. And particularly if it's, if there's not an easy way for the doctors to know how to identify depression, it just makes it all that much more difficult for people to get the help that they need. Now, there have been tools that have been developed over the years that are included in some of these resource toolkits that will be available to everyone that makes it a lot easier in terms of standardized approaches to identifying people with depression. And again, this is something that doesn't have to happen within the doctor's office, but can even happen outside. And when patients know that they have depression and want to get help, this is something that they can bring up to their physician. As Jeannie mentioned, there are problems in terms of starting treatment. And we know that while depression can be treated with medications and can also be treated with psychotherapy, first of all, the primary care physician, I never got trained in terms of providing psychotherapy. So if somebody wanted that kind of treatment, I'd have to find somebody to refer them to. And we know that in our system today, there's not a lot of crosstalk between what happens on the physical health side and the mental health side. So finding somebody to connect with is really difficult for that primary care doctor. In terms of other issues, not only is it just getting that patient into the room, we want to make sure that we follow up with things. As Jeannie mentioned, we know that for a lot of doctors who start treatment, they only, the patient might take an initial pill and might stop because they might experience some minor side effects that you don't understand. So first of all, there's an issue of not getting enough treatment. We know that medications may not get refilled. And patients sometimes might need stronger or different medications, and until they have that sort of follow-up, which we already talked about the problems of getting people into the first visit, the same sort of problems happen in terms of coming back again. And also on top of that, we know that sometimes people stay on treatment even when they've already gotten better and they keep taking medications. We know that for depression, not everybody needs to take medications all the time. People do get better, but sometimes medications don't get stopped. Now again, in these resources that we've developed over the years, there's information for providers to be able to identify these problems, know when to start treatment, what are the side effects, and when should they stop treatment. And then finally, we also know that, again, as I mentioned earlier, there's difficulty with patients who might need more help. For example, we were talking about patients with substance abuse disorders. If they need help with their substance abuse disorder as well as with their depression, sometimes we need to make additional referrals to make sure that they're getting all the help that they need. And again, as I mentioned earlier, that split between the mental and physical health services makes it difficult for them to get that kind of help. So, at the bottom line is that, the primary care provider can do a lot if the patient gets into the door. But we know that it's not the only solution that's out there, and we probably need a lot more assistance as physicians to really help all the patients that are out there that are suffering from depression. And I think that by hearing some of the other components that have been developed in this collaborative care model, you'll see what some of these different components are. So I'll hand over the microphone to Vicki, and then later on we'll hand it over to Craig in terms of hearing these different components to this collaborative care model.